Good afternoon, ma'am. Good afternoon, my dear friends. Today, the topic of my seminar is on IMNCI, Integrated Management of Neonatal and Childhood Illness. First, we'll go with the introduction. More than 9 million children die in developing countries before they reach their fifth birthday, and many of them during the first year of life. It's more than 70% of the child that is due to the five diseases, namely pneumonia, diarrhea, malaria, and malnutrition, and acute respiratory infection. And this integrated management and childhood illness was developed by WHO and UNICEF in the mid 1990s. This tragedy has been expanded in India to include neonatal care at home as well as in the health facilities, and it is renamed as Integrated Management of Neonatal and Childhood Illness. Next, the definition. It is an integrated approach to the child health that focuses on the well-being of the whole child. It focuses primarily on the most common cause of child mortality, diarrhea, pneumonia, measles, malaria, and malnutrition, and illness affecting child from birth to 2 months. 2 months to 5 years, and include both the preventive and curative elements to be implemented by the families and communities as well as by the health facilities. And the aim of IMNCI is to reduce the death, illness, and disability, and to promote improved growth and development among children under 5 years of age. The objective of this IMNCI is to reduce death rate in children, to reduce the frequency of illness, and to bring down the severity of illness and disability, and to contribute in improvement of growth and development of the children's life. And next we'll go with the components. Number one, health worker components, that is improvement in the case management skill of health staff through the provision of locally adapted guideline on IMNC and through activities to promote their use. And the number two, improvement in health system required an effective management of childhood illness. And number three, improvement in family and community, means like the major highlight of Indian adoption is number one, inclusion of 0.7 days in the program, incorporation of national guidelines on malaria, vitamin A supplementation and immunization schedule, and the training of health personnel begin with sick young infant up to the 2 months, and provision of training time devoted to sick young infant and sick child is almost equal, and it is a skill based. Next, we'll go to the principle. Number one, all the sick children under 5 years of age must be examined for condition which includes immediate referral or hospitalization. Examine all sick children aged up to 5 years of age for general danger sign, and all the young infant for sign of very severe disease. This sign indicates severe illness and the need for immediate referral or admission to hospital. Number two, children must be routinely assessed for major symptoms. The children and the infant are then assessed for main symptoms. In older children, the main symptoms include cough or difficulty in breathing, diarrhea, fever, and ear infection. And in young infant, the main symptoms include local bacterial infection, diarrhea, and jaundice. And then in addition, all the sick children are routinely checked for nutritional and immunization status, HIV status in high HIV setting, and other potential problems. Only a limited number of carefully selected clinical signs are used based on the evidence of drug sensitivity and specialty to detect disease. A combination of individual sign lead to an infant or a child classification rather than a diagnosis of classification is based on a color coded. Pink indicates urgent hospital referral or admission, and yellow indicates initiation of specific treatment, and green care for home management. This IMNC management principle use a limited number of essential drugs and encourage active participation of caregiver in the treatment of their children. And essential components of IMNC is the counseling of caregiver regarding home, are appropriate feeding and fluids, when to return in the clinic immediately, and when to return for follow-up. Next, the elements of case management process. The components of case management process involves the following elements: assess, classify, after classifying, provide practical treatment, counseling, and follow-up. Assess a child by checking first danger sign, possible bacterial infection in any young infant, asking question about common condition, examining the child and checking nutrition and immunization status, assessment including checking the child for other health problems. After assessing, classify a child illness by using a color-coded system. Because many children have more than one condition, each illness is classified according whether it requires urgent pre-referral treatment and referral of pink. It is pink color, and specific medical treatment and advice is yellow, and simple advice on home management is green. After classifying the condition, all the condition, identify specific treatment for the child. If the child requires urgent referral, give essential treatment before the patient is transferred. If a child needs treatment at home, develop an integrated treatment plan for child and give the first dose of drug in the clinic. And if the child is not immunized, give immunization. And after classifying all the condition, provide practical treatment instruction, including teaching the caretaker how to give oral drugs, how to give feed and give fluid during illness, and how to treat the local infection at home, and ask the caretaker to return for follow-up on a specific date, and teach her how to recognize signs that indicate the child should return immediately to the health facilities. And after that, after providing practical treatment, counseling. Assist for feeding, including assessment of any breastfeeding practices, and counsel to solve any feeding problems found. Then counsel the mother about her own health. After counseling, when a child after counseling, follow up. When a child brought back to clinic as requested, give follow-up care, and if necessary, reassess the child for few problems. The integrated case management process: check for danger signs like convulsion, lethargy, unconsciousness, inability to drink, and vomiting, and assist for main symptoms: cough, difficulty in breathing, diarrhea, fever, and air problems, and assist for any nutrition, immunization status, and potential feeding, and check for any other problems. And after that, classify the condition and identify the treatment according to the color coded treatment. Urgent referral, pre-referral. In this, urgent referral is pink, and treatment in OBD is yellow color, and home management is green color. And then in this urgent referral, pre-referral, advise parents all the referral activities, diagnosis, and treatments. And in treatment and OPD, treat local infection, give oral drugs, advise and teach mother, and after that, follow up. And in home management, counsel the caretaker how to give oral drugs, treat to local infection at home, continue feeding, and danger of follow-up sign. This is how to classify, assess and classify the children between 1 week and 2 months. Check for severe disease and local and bacterial infection and jaundice. Ask the mother, has the infant has any convulsion? Look, listen, and feel. Count the breathing 1 minute and repeat the count. Look for any severe chest inverting. Look for any nasal flaring, any discharge from the ear, and look for umbilicus is red, or if there is any drainage or pus, and measure the temperature, and look for any young infant movement. For jaundice, the palms and sole are yellow. After that, this pink color indicates possible serious bacterial infection, and the signs are convulsion, fast breathing, severe chest inverting, nasal flaring, and bulging of fontanelles, and the temperature will be 35.5 degrees Celsius, and the infant will have lethargic and unconsciousness, and the treatment is to give first dose of intramuscular ampicillin and gentamicin, and warm the young infant by skin to skin contact if the temperature is less than 36.5 degrees Celsius, or feel the cold to touch while arranging for referral, and advise mother how to keep the infant warm on the way of the hospital. And this yellow color indicates local bacterial infection, umbilicus, red, or any drainage of pus or pus discharge from the air, and to give oral antibiotics, teach mother to treat local infection at home, and follow up in 2 days. None of the severe sign of very severe disease or local bacterial infection. This green indicates no severe disease or local infection, and advise mother to give home care. And this is for classification of severe jaundice. If there is the infant palm and sole are yellow, and the age of the infant is less than 24 hours, and the age is more than 14 days, there is and treat for prevent low blood sugar, and refer urgent referral to hospital, and advise the mother to keep the baby warm. And if the palm and sole are not yellow, this is jaundice, and advise the mother to give home care for the young infant, or advise mother to return immediately if the palm and sole are yellow, and follow up in 2 days. And this is for diarrhea. Ask the child have any diarrhea. If yes, then how long, and the general condition like lethargic and unconsciousness. Look for sunken eyes, restlessness, and pinch the skin of the abdomen and notice how it goes back, or it is very slow, or slowly, or immediately. After that, if there is severe dehydration, the two of the following sign will be there in the infant, like movement only when stimulation, or no movement at all, or sunken eye and skin pinch goes back. The treatment: if the infant has no longer severe classification, give fluid for severe dehydration, refer urgently to hospital with mother giving frequent sip of ORS on the way, and advise mother to continue breastfeeding. And these two of the following sign, if there is some dehydration, the two of the following signs are restlessness and irritability, sunken eyes, skin pinch goes back, or fluid, or give fluid and breast milk for some dehydration. Refer urgently to hospital with mother giving frequent oral sip of ORS. And if there is no hydration, give fluid to treat diarrhea at home, and continue for breastfeeding, and advise mother when to return immediately, and follow up in days if not improve, and check for feeding problem or low birth weight. Ask the mother if there is any difficulty in feeding, and if yes, is the infant breastfeed? If yes, then how many times in 24 hours? Does the infant receive any other food or drinks? If yes, then how often? What do you use to feed the infant? Look, feel, like determine weight, mid arm circumference, and how to assist the breastfeeding. To check the attachment, look for chin touching the breast, mouth wide open, lower lip turned outward, more areola visible above than below. These are the as you can see in the diagram, is as you see in the picture. Then the feeding problem and malnutrition. If there is severe malnutrition, the infant will not be able to feed, no attachment at all, very low weight for age, and the treatment is give vitamin A if visible, and severe wasting and edema of both feet present, refer urgently to hospital, or treat the child to prevent low blood. Feeding problem or low weight, not well attached to breast, not sucking well, less than 8 breastfeeding in 24 hours, thrush, ulcer or white patches in the mouth. If not well attached, teach correct position, like teaching them the breastfeeding techniques and increase frequency of breastfeed, treat trash at home, advise the mother how to feed and keep the low weight infant warm at home, and follow up. After that, no, if there is no feeding problem, this green color indicates no feeding problem. Advise the mother to give home care and advice for follow up. And this is how to assess and classify the sick age from 2 months or 5 years. uh, Cough or difficulty in breathing. If there is cough or difficulty in breathing, if yes, then for how long? Look, listen, and feel, and count the breath in 1 minute. Look for chest inverting,